The emergency room. When critically ill or injured, it's the best place to receive the best care. But every year, millions of people visit hospital emergency rooms across the nation for conditions that are urgent but not life-threatening. The result? According to the Centers for Disease Control and Prevention, the average time spent in an emergency room is more than 3 hours.
The emergency departments in the United States are in a crisis state. Approximately 70% of the patients that are seen in the United States are not actually emergencies. What we are finding today is that the patients that have to be seen in the emergency room for a true emergency are waiting, and this translates to longer wait times for both those acutely ill and those non-acutely ill.
It's a problem that has led to the rise of a relatively new discipline of medicine known as urgent care. Designed to provide patients access to efficient and quality care for less than life-threatening medical situations, many healthcare professionals are recognizing urgent care centers as a viable alternative to primary care physicians and hospital care.
Urgent cares fill the gap between primary care medicine and hospital emergency departments. Urgent care is more cost-effective, it's more convenient, it's more accessible than the hospital emergency department, and on the primary care side, it is certainly no appointment needed, so that makes it more accessible.
At an urgent care center, appointments are not necessary and the facilities are staffed by skilled physicians and nurses. In addition, diagnostic equipment and lab tests are also available on site.
Urgent care centers in the United States are open 7 days a week, 365 days a year. They see from children to adults. We see acute and episodic injury and illness. Basically, any patient that walks in the door, we see them without an appointment, and we take excellent care of them, the care that they could expect to receive in a doctor's office or even in an emergency department.
With statistics showing that there will be more than 70 million people over the age of 65 by the year 2030, urgent care centers are helping fill a medical niche for the aging boomer population. In addition, many working families, especially those with young children, are finding urgent care centers ideally suited to their lifestyle.
Well, I got a phone call from my son's school that he was running a mild temperature, possibly had an earache, and I had to pick him up from school. I wasn't able to get him into his pediatrician. I knew this place was open 7 days a week from 8 in the morning to 8 at night. I brought him in knowing that I'll have no wait time, and I was in and out in an hour.
Many employers across the U.S. are realizing the value urgent care centers provide to their companies and their employees as well.
Urgent care centers that provide occupational medicine and workers' comp services are able to see employees immediately, 7 days a week when they get injured. They could do a drug screen on the employees, they could dispense medications to the employees in-house. That way they could get better sooner and get back to work quicker.
As centers continue to build relationships with major health insurers, as well as utilize networking solutions to streamline operations, patients are finding that a visit to an urgent care center is less costly compared to that of a hospital emergency room.
Not all urgent care centers are created equal. MD Now Medical Centers, Urgent Care America, and a few select centers utilize electronic medical records. It adds for much more of a seamless integration between the billing component and the documentation. Helps patients get seen quicker in a much more cost-effective manner.
The United States healthcare system is going to have to and will evolve over the next few years. And specifically, healthcare is going to have to become more cost-effective. It's going to have to become more accessible, and it's going to have to become more transparent to the user relative to their medical record. Those are the three things that are going to have to change in our healthcare system, and urgent care plays a critical role in all.
Tired of endlessly waiting in a crowded hospital emergency room for a non-life-threatening medical situation? Next time you're ill or suffering from a minor injury and need to see a doctor stat, try a visit to an Urgent Care America Center instead.
MD Now and Urgent Care America offer immediate medical care from children to adults, non-life-threatening injuries and illnesses, anybody that needs immediate medical attention.
Urgent Care America has created the nation's most comprehensive network of independently owned urgent care centers, providing access to quality health care when patients need it most.
Urgent Care America brings together the best technological solutions in the marketplace to independently operated urgent care centers in order to bring them together and improve the operating performance of each of the centers, as well as to improve the quality of service provided to patients in all of them.
The unique Urgent Care America Passport system is powered by NextGen and is one of the few systems certified by CCHIT and is a key to the success of Urgent Care's affiliated network. The system allows centers to utilize standardized electronic medical records that can be accessed by any Urgent Care America facility that a patient visits, providing physicians with critical up-to-date medical information for each patient. In addition, most centers offer their patients InstiMeds, an innovative automated prescription drug dispensing system designed to save time by avoiding a trip to the pharmacy.
Urgent Care America uses NextGen EMR practice management and back office solutions. Using a single solution in all three areas allows for a seamless and transparent management of the practice management, the patient accounts, and the medical record of the patient. This facilitates the use of the UCA Passport card, which, when issued to a patient, allows for a seamless transport of that record and access to the provider, improving quality, cost, and efficiency of the delivery.
In addition, most Urgent Care America facilities offer a unique and innovative way to dispense prescription medication to patients.
Our practice management and EMR solutions connect directly into InstiMed's medication dispensing system and takes care of everything from the filing of the claim to the dispensing of the medication, and even has a phone access so that you can speak to a pharmacist directly if you have any questions about the medication being dispensed.
By providing fast access to skilled emergency care physicians in a comfortable and affordable private setting, Urgent Care America is changing the way patients receive health care today and into the future. For more information and to find an Urgent Care America facility in your area, log on to urgentcareamerica.net.